Hey fellow breathers, my name is Kelly Brower. I'm a licensed physical therapist and athletic trainer, and I'm here today to talk to you about breathing and the ever-dreaded mask. These puppies ain't going away anytime in the near future, so it's up to us to make sure that we're breathing efficiently and effectively with or without a mask. I train patients in the clinic to breathe. I think that you can use those same strategies while wearing the mask to make mask wearing easier and more tolerable in your everyday life. First of all, go back to the basics. Make sure that your normal breath pattern is efficient and effective. Do this by practicing diaphragmatic breathing. I have my patients lie on their back with their feet up. I have them place one of their hands on their belly so they can feel, and you're going to work on taking nice deep breaths in through the belly, keeping the chest nice and silent. An important part of breathing is making sure that your rhythm or your frequency of breath is where it needs to be. In order to get your frequency of breath where it should be, once a patient takes a deep breath in, I cue them to take a 1-second pause at the top of the inhale. Once they've inhaled and paused the second, I have them exhale comfortably. At the very end of that exhale, you're going to take a 3-second pause. It's going to feel like a long time for most of us, but then you can go ahead and take your next inhale. I have them train in that position for about 5 minutes or until they've demonstrated that they can efficiently and effectively produce air through the belly and control that pattern. That's where I would start. Maybe 5 minutes a day. Train yourself at home with that mask on. Once you've mastered that, then you can go ahead and start changing up your position. You can work on crocodile breathing with your mask on, which is face down breathing, breathing your tummy into the table or the floor or the bed or whatever you're laying on. Then you're going to work to a hands and knees position with that breathing with the mask on, and then sitting and standing and then moving. It seems really silly to train with your mask on, but like anything in life, practice makes perfect. We're really training our central nervous system, specifically the sympathetic portion of our central nervous system. That system is also called the fight or flight system. Lots of us, when we put a mask on, tend to start to breathe too quickly. We actually hyperventilate. And coincidentally, when we hyperventilate, that changes our blood gas concentration and can further exacerbate the sympathetic nervous system, making it feel like we're having anxiety every time we have to put the mask on. By practicing and working through on your back, on your tummy, on your hands and knees, sitting, standing, and moving, and spending a few minutes on each of those every day until we feel confident in that, it is going to start to really help and influence that part of our system so that it's not becoming overactive and it makes mask wearing basically a breeze. I want to point out one more thing. When you're breathing, make sure you're always breathing with your mask through your nose. There are also reports and studies coming out that people are developing an increase in gum disease and cavities because they're breathing through their mouth while wearing the mask. Your mouth needs to stay wet. We need saliva on our teeth and gums so that we're constantly washing off bacteria. When you breathe through your mouth, you're actually allowing all that saliva to dry up, and it allows bacteria to do their work on our teeth, which is not a good thing. So make sure while you're practicing all those strategies, breathe through your nose, just like you would in everyday life. I hope that this has been valuable, and I hope that you get some takeaway, and I really hope going forward, you just keep breathing.